Good morning, everybody. Okay, much better, much better. Welcome to the Boston University School of Public Health. My name is Lisa Sullivan. I'm the Associate Dean for Education and a professor in the Department of Biostatistics here at the school. I'm actually standing in this morning for this piece for Anne-Marie Larice, who is our Director of Admissions. Some of you may have spoken to her. She unfortunately has this stomach bug that is going around, so in the interest of public health, we had her stay home. So welcome. It is such a joy to have all of you here at the school today. I have the great pleasure of serving on our school's admissions committee, and so I see all of your applications coming in, and literally you have been selected from among thousands of applicants as those with the greatest potential to make a difference in public health. So it's great to have you all here today to learn more about our school. We actually have two goals for you here today. One is for you to get a feel for what it's like to be a student at this school. So we have a day set up for you where you get to meet our faculty, other students, administrators. You'll get to sit in a classroom where you kind of get the feel for what it's like to be a student in the classroom here. And the second thing for you today is to get every question that you have answered. It's really important to us that you know exactly what we are all about here. We want you to get every single question, no matter what it is, answered by one of us. If we don't address your questions in our presentations, you'll have plenty of opportunity to ask questions. Pull any of us aside if you have things that haven't been addressed, because we absolutely want you at the end of this day to know what we are all about and to be able to make a good decision as to whether this is the right place for you. Okay? So the day is set up. So this morning we have a couple of speakers that will talk to you about the school, how we're structured, what we're all about. And then we're going to, at lunchtime, separate our students from our parents, friends, and guests. The students are going to meet with our faculty and go through a mock classroom. It's not stressful. There are no exams or anything like that. You'll just be discussing an important issue, climate change, together and trying to get the feel for what it's like to be a student in the classroom. And several of us will take the parents, friends, and guests separately off for lunch, and we will address any questions that you may have, because oftentimes the parents, friends, and guests have different questions than do the students, and so we will address those separately. And then after lunch, we'll have several sessions where you'll get to meet with people from our housing office, financial aid, you get to meet with current students, alumni, and again, another opportunity for you to ask questions, hear from people what their experiences were like, so you can make your best decision. And then we'll all reconvene back in this room later this afternoon for a nice reception. So hope to get to see and meet each and every one of you through the course of the day. All right, so we'll kick off the morning first with our dean. It is my great pleasure to introduce our dean, Sandro Galea. He is the Robert Knox Professor and Dean of the Boston University School of Public Health. Before coming to Boston University, Dean Galea was the Gelman Professor and Chair of the Department of Epidemiology at Columbia's Mailman School of Public Health. He was named one of Time Magazine's epidemiology innovators and has been listed by Thomson Reuters as one of the world's most influential scientific minds. In his latest book, Healthier, 50 Thoughts on the Foundations of Population Health, it has been called the book everyone in health should read by Fortune magazine. Dean Galea has published more than 800 scientific articles, 50 book chapters, and 13 books. His forthcoming book, Well, What We Need to Talk About When We Talk About Health, will be published by Oxford University Press in May of this year. He has contributed to a number of leading publications, including the Boston Globe, Harvard Business Review, the New York Times, Wired, Time, and Fortune magazine, among many others. Dean Galea serves as the chair-elect of the board of the Association of Schools and Programs of Public Health. He is a past president of the Society of Epidemiologic Research and an elected member of the National Academy of Medicine and of the American Epidemiologic Society. He has received Lifetime Achievement Awards for his research on mental health, trauma, veterans' health, and the social determinants of health. It is my great pleasure to introduce Dean Sandro Galea.
Thank you, Dean Sullivan, for that very kind introduction. So good morning, everybody. Good morning. Again, good morning. All right. So as you heard, it's my great privilege to serve as Dean of the School of Public Health, and I'm here to welcome you. And I want to start with two stories, if I may. And both stories, I'm going to go back to the beginning of the 20th century. So I'm going back to the beginning of the 20th century. And in Texas, around sort of early 1900s, a man was born. His name was Willie Johnson. Willie Johnson was born, and when he was around 7, there was a domestic violence incident, and his mother threw lye in his face, and he became blind. And he became known as Blind Willie Johnson. Some of you may know him, those of you who know the blues, because he grew up to be a blues player, and which is why we remember him today. Now, Blind Willie Johnson grew up at the turn of the 20th century in Texas, poor, and he got married, and him and his wife were living in a small hut. He made a living sort of busking on street corners, not a very good living, as you might imagine. And their house burned down, but they had no money, so they kept living sort of in the burnt-out husk of the house. When he turned 40, Blind Willie Johnson developed malaria. Now, this is in the 1940s in Texas, so malaria was actually quite common. And his wife took him to hospital. She took him to hospital, and he was turned away from the hospital. Now, it's not clear if he was turned away because he was blind, because he was black, because he was poor. And then he died. Now, I tell you the story of Blind Willie Johnson because the question is, what killed Blind Willie Johnson? Now, the answer to what killed Blind Willie Johnson is obviously malaria. That's what killed him. Right? Had he had chloroquine or mefloquine, he would have lived from his malaria. But the reason I tell you that story is because I think when you hear it, you realize it wasn't just malaria that killed Blind Willie Johnson. It was malaria, yes, but it was also poverty, it was also homelessness, it was racism, it was domestic violence. All those forces also killed Blind Willie Johnson. So that's story one. Let me tell you a second story. In 1918, now we're dealing with the period Blind Willie Johnson also lived, there was a great flu pandemic around the world. 1/3 of the world's population was infected by the flu. 50 million people died around the world. 700,000 Americans died from the flu pandemic. The flu pandemic of 1918 resulted in a 3-year period when the United States lost life expectancy, which means people were living less and less for 3 years in a row. The United States has never had another episode where we have lived less and less for 3 years in a row until last year. So 2018 marked the middle of a 3-year period, the third year of a 3-year period, where we, in this country, have been living less and less. 16, 17, 18 has been a downturn in life expectancy for 3 years in a row for the first time since the 1918 flu pandemic. Now, if I may, raise your hand how many of you knew that. It's okay if you don't. Raise your hand how many of you knew that. Okay, look around the room. It's about 5% of people knew this. Now, I actually use this fact in talks to smart, educated audiences all the time. It's always about 5 to 10% of the room who knows that. Now, let me ask you another question. Raise your hand how many of you think you should have known that? Right? Isn't it amazing? So let me bring the two stories together. The Blind Willie Johnson story paints the case for what public health does. Because one of the challenges sometimes we have in public health, and those of you who are students, prospective students, and you're talking to your family members, I'm sure you get the question, well, what is this public health again? Don't try to define it. Just tell them the Willie Johnson story. Because public health is about malaria, yes, but it's also about homelessness, racism, and poverty, and domestic violence, and access to care. Public health is about looking at the world and saying, our life expectancy has been getting worse and worse for the past 3 years, and we should all know about it. And public health is about saying, what is it that's contributing to our life expectancy going down year after year, and what is it that we as a society can do to build a better world? Now, that is what makes public health so exciting. What makes public health so exciting is the fact that our scope and remit is not just malaria, but it's also homelessness, access to care, racism, domestic violence, and issues that have real contemporary consequence and moment. In my own journey, I started off as a physician, as many people in my generation who made a career in public health did. It was not atypical for people of my generation. It's different, I think, for your generation. And I was a doctor for many years. And then I shifted to public health. Why did I shift to public health? Because I was actually tired and dissatisfied of dealing only with the malaria. I wanted to deal with the full scope of conditions that ultimately create health. That's what took me on my journey in public health. As Dean Sullivan mentioned, I was last in New York, and I have been here now for almost 5 years. Now, why did I come here? I came here because this school stands for a vision of public health that brings together what you've seen in our core purpose, think, teach, do. We aspire to do 3 things and to do them all really well. We aspire to generate scholarship, we aspire to teach our students, and we aspire to be part of the world that makes change happen so we can create a better world. You are this morning going to hear from Dean Sullivan, who you already heard from, who is the dean who is in charge of the teach part of our think, teach, do. From Dean McLean, who's the dean in charge of the think part of our think, teach, do. And from Dean Cox, who is the dean in charge of the do part of our think, teach, do. As we often say to our school community, the good news is we're very clear about what we do. The bad news is that we really want to be excellent at 3 things, not just one thing, 3 things. And that's what distinguishes the school. I'm often asked that as a dean of the school. Why is the school different? How is the school different than other schools? It's different because we see our role very clearly as having excellence in teaching, in scholarship, and in action. And that, really, to my mind, is what public health professionals should want to do. This is a great school. We have outstanding faculty who care deeply about what they do. It's a school that's founded on the principles of social justice, a school that understands the story of Blind Willie Johnson and its DNA. This is not something which I've brought to the school. It's been like this since the school's founding. It is one of the leading schools of public health in the world. And it is a school in a city, which, as one of my colleagues put it, is like a modern-day Athens. This is really an enormous privilege to be part of this community, to be part of a community with 10,000 alumni who are in 117 countries, active, about 1,200 students, 350 faculty, 250 staff. It is a community that has the privilege every day of coming here to learn, to generate scholarship, to be part of making change happen, and to do that in a way that advances and creates a better world. Congratulations to all of you for being accepted. Congratulations with the decisions you have to make ahead of you. I understand these are hard decisions. The good news is you're going to be fine no matter what you choose. You're going to be okay. And I hope you will join us. I think you'll find that this is a great place to be a student. You'll find it's a community that will welcome you, and you'll find that you'll really enjoy your years here. Thank you for being here with us here this morning.
Okay, I'm back, but this time in my role, I am the Associate Dean for Education. So what I would like to do is talk to you about our educational programs here at the Boston University School of Public Health. So our educational mission is to provide you with the knowledge, skills, and confidence to go out and practice public health. Our approach for every degree program is to ensure that you have a strong foundation in the knowledge and skills that are required for 21st century public health professionals. You will all choose different specializations within your different degree programs. These have been specifically designed to meet the needs of the field. And you will all also have opportunities for professional development and practical experience. When you finish your program, you'll have the skills and the confidence to go out and do the work that needs to be done. You are in the right place at the right time. The healthcare sector is expected to be the largest source of job growth in the next few years. The Association of Schools and Programs of Public Health estimates needing another 250,000 public health workers by 2020, which is exactly the time that you will be graduating from this program. And there are shortages in lots of different sectors that need your expertise. So our approach, as Dean Galea said, is built on 3 things: the think, teach, do, education, research, and practice. All of our faculty do all of those things in different combinations with different areas of focus. We have a strong and growing research base. You'll hear about that. Many of you will be interested and will have the opportunity to get involved in those research projects. We also have a commitment to service and activism. You'll hear about that too this morning, about the kinds of projects that our community engage with. Our programs are also very flexible. They've been designed that way because you have lots of things happening, lots of opportunities that you also want to engage with, so you can design a program that works for you given all of the things that you have on your plates. So let me just tell you a little bit about a project that I have had the great privilege to work with. I'm a biostatistician, and I've had the opportunity to work on the Framingham Heart Study. Have any of you ever heard of that study? So it's the longest running study of risk factors for cardiovascular disease. And it actually started in 1948 in the town of Framingham, which is about 15 miles west of here. Enrolled just over 5,000 individuals living in that town, because at the time there was what they called an epidemic of cardiovascular disease, more cases of cardiovascular disease than had been seen. And the question came up, why is there so much happening here? So the Framingham Heart Study is actually based here at the Boston University School of Medicine. The principal investigator is there, and for many years, the co-principal investigator has been either a statistician or a biostatistician. So lots of us at the school are engaged with this study. I've had the great opportunity to work on a small piece of it. You can imagine it's actually quite a huge study. And the piece that I got to work on was in developing what we call risk prediction functions. These are mathematical equations that an individual can plug in their risk factors, their individual values, and it produces a probability that you might suffer future cardiovascular disease. So just to give you an idea, on the right-hand side of this screen is a screenshot of an app. So in order to make this accessible to people, these risk functions were built into an app. So sitting behind this is a mathematical equation. So the person using this app has indicated that they are a male between the ages of 40 and 44 years of age. Their total cholesterol is between 200 and 239. Their HDL cholesterol, the good cholesterol, is between 35 and 39. Their systolic blood pressure is between 140 and 149. They are not on treatment for hypertension. They happen to smoke and do not have diabetes. So they've plugged in those risk factors. And then this app calculates their 10-year probability of developing cardiovascular disease as 18%. Does that seem like a high number? It depends. So we struggled with this. How do we make this accessible and interpretable to people? You will hear about this much more. We do research here so that people can use it, not so that we can talk to other scientists, but so that it gets out there and actually helps people. So one of the things that got added to this app was the very bottom part, which says, given this risk profile and this probability, this looks like the heart of a person who's 68 years of age. Is that good? Why not? Why is that not a good number? Because the person is between 40 and 44. You don't want a heart that's 20 years older than what you really are. You'd actually like it a little bit younger, right? So this was an attempt for us to make this information accessible, make somebody say, oh boy, that doesn't look good. What can I do to bring this down? So this is just an example of a project. I happen to teach our quantitative methods course in our MPH program. I do research on the Framingham Heart Study, and I can bring these research endeavors into the classroom. And that's what you'll hear about. This is how we operate here. People are doing research, teaching, doing practice, and it's all coming together in the classroom, and our students are very much engaged in all of this. So let me tell you a little bit about our programs. So we have lots of different degree programs here at the school. The Masters of Public Health is our largest program. We have Master of Science programs, and I know some of you sitting here have been accepted into those programs. We have a graduate certificate in public health, and we also have several PhD and a DRPH program. So most of you are here for the Masters of Public Health. I'm going to focus on that this morning, but you will all have the opportunity to meet faculty in the programs to which you have been accepted. So even though I'm focusing on this, it's really to give you a feel for the way we operate. The Master of Science works in exactly the same way. So the MPH has three components. A foundation, which consists of our integrated core. I'll tell you a bit more about that. Specialization options, where you can pick and choose options that best meet your professional goals and interests. And then the third piece is the professional development and practical experience piece. We feel very strongly that you need mentored opportunities while you're here as students to build your professional skills and also to develop confidence so that when you go out, you can hit the ground running. So there are 4 courses that all MPH students will take: Quantitative Methods for Public Health, Individual, Community, and Population Health, Health Systems, Law, and Policy, and Leadership and Management for Public Health. So all of the students coming into the MPH take those 4 core courses. We organize you into cohorts. We are a big school, and what comes with a big school is a lot of opportunities. So if any of you are thinking, this is a big school, I don't want to get lost in the shuffle of a big school, we actually organize you into cohorts of about 60 students each. Each cohort takes their 4 core courses together in the MPH, and you get to know your cohort mates very well during that time. And I will say that's actually a good number so that you don't get to know them too well, if you know what I mean. So that works well. You get to know people, you get comfortable with that group, and you work through your core courses together. Full-time students take all 4 of those courses at once. So if you enter in the fall, you take all those 4 courses all at once. Lots of our students take 2 courses if you want to enter part-time, and that's perfectly fine. Again, you can switch between full-time and part-time anytime during your tenure here. Opportunities may come up for you to jump onto a project or take on a part-time job, and that's perfectly fine for you to do, to shift between part and full-time while you're here. So this is just a sample schedule for a full-time student. So a particular cohort might have their Health Systems, Law, and Policy course on a Monday morning, Leadership and Management Monday afternoon, Quantitative Methods on Wednesday morning, and Individual, Community, and Population Health on Wednesday afternoon. Our courses meet once a week for 3 hours. That's why they're organized that way. Each cohort also has a lab attached to it. That's a time where you all get together in your cohort to apply the skills that you're learning, putting all of these things into practice. We also have a new hybrid option open this fall, which will allow students who are interested to take their core courses online. So if you have a great job right now and you feel like I really don't want to leave it, or you're not from the Boston area and you feel like, you know what, I want to complete these courses from where I am right now and then come, that is also an option to you. So we'll be asking you as you make your decisions if you are interested in this particular option. Again, this was designed in response to our students saying we need a bit more flexibility in doing these, so we tried to respond by offering this option. In the MPH, after you take the core, you will choose your specializations, and these come in the form of certificates. You will all be required to choose a functional certificate, and these have been designed specifically, working with employers to meet the demands of the workforce. So these are designed around particular functions that you will perform in the workplace. So you all choose a functional certificate. If you're interested, you can add to that a context certificate. About 2/3 of our students choose a functional and a context. The other 1/3 choose a functional and then fill the rest of their program with electives, and that's perfectly fine. You can design it in whatever way works for you. So these are the functional certificates. I know our applicants are well aware of what these look like, but we have lots of offerings here: community assessment, program design, implementation and evaluation, environmental health, epidemiology and biostatistics, and so forth. So all of you will choose one of these. Now, if you feel like I don't know what I should choose, that's perfectly fine. This afternoon, we will have faculty here representing every one of these, and you can talk to them. We also allow you to not choose before you come in. In fact, it's fine with us if you don't know. You come in and take the 4 core courses and then get a feel for what do these things look like? What are my options if I take this particular certificate? So you can choose once you've gone into the core a little bit and get more of a feel for what happens and then make that decision. That's perfectly fine. Again, you can add to that a context certificate, maybe in chronic and non-communicable diseases, global health, human rights. Any of these are possible to add on to the functional if you so choose. Just to give you an idea of how our current students have selected. This may work for you too. We never really know. Epidemiology and biostatistics is the most popular. Of course, I think that's not surprising as a biostatistician. Why wouldn't you want to pick that? Some of you may think I have no idea why someone would want to pick that. But community assessment, program design is also very popular, as is healthcare management. Health policy and law is also quite popular. But you can choose any of these, whatever interests you the most. And here's how the context certificates fall. So there's a lot of interest in global health, maternal and child health, infectious disease, and so forth. But these are all open to you. And then that third piece is the professional development and practical experience piece. All of the students in the Master of Public Health do a required practicum, which is 240 hours. That's where you go out into an environment and practice what it is you're learning. We have students who do practica here in Boston, around the country, and around the world. We have a phenomenal career services and practicum office. You will meet some of this staff in that office later today. We have a database with literally thousands of opportunities, so you don't have to think, oh my God, where am I going to find such a thing? We can actually help to direct you to opportunities that are there. There have been many students before you who have gone through these things, and you can see what others have done and what might interest you. We also have a required career preparation program. This is to make sure that you can best and most effectively market yourself. So all of you will take this program where you will learn to develop a very good cover letter. Make sure your resume looks good. Make sure you have a very good 30-second elevator speech, and so forth. So this is where we make sure that you are prepared to go out and land that practicum, to go out and land that job. And then all of you will do an integrative learning experience. These are tied to the functional certificates, and at the end of these, you will have a work product tied to the particular area of expertise you're interested in that you can then bring to an employer and say, this is what I can do. And you can demonstrate what it is you're able to do. Again, you can customize your program in the way that works for you. You can go full-time, you can go part-time, and switch in between. Lots of students flip back and forth, again, depending on what's happening for them at a particular point in time. Choose your certificates and your electives. You can customize a program that best meets your interests and goals. And you'll have lots of opportunities to build your skills and confidence. We are very serious about you being successful in this program. We have a very strong network of advising and support to make sure all of you can navigate the system and be successful in getting through it. We have professional staff advisors. You'll meet some of them. Some I've mentioned. Our staff in the Career Services and Practicum Office are tremendous sources of advice. You will all also be assigned a faculty advisor. Every one of you will be assigned a faculty advisor in your area of interest. We also at this school have an open door policy that we take very, very seriously. Every faculty member is here because you are here. So if you have a question, it doesn't matter if I'm your advisor or not, you can come meet with me, and I'm happy to meet with you. Again, career services, we have alumni mentors. As Dean Galea mentioned, we have over 10,000 active alumni. This is a tremendous opportunity for you because networking makes a huge difference. And so joining our community, you join this network of alumni, and they can often open doors for you, make connections for you. We have an Office of Graduate Student Life. You'll meet the director this afternoon. We offer peer coaching. This is great because not everybody has to be great at every one of those core areas. Some of you may say, you know what, quantitative methods may not be my thing. I'm really here for social justice. But you have to be able to look at data and use data effectively. So if you need a little extra help, a little support in that area, we provide that free to you. So we have students who've gone before you, who are peer coaches, peer tutors, that can help you if you need it. That's open to you if you're interested. We have a writing and presentation center. Again, if you're preparing a presentation for a professional conference, which we encourage and support, work with our writing and presentation center, tune it up, get feedback, and make sure it looks as good as it can look before you go out there and represent the school. We also offer conference travel grants. Our students do go to conferences. We encourage this, and we can support you with a travel grant to go out and attend a conference. Just to give you a feel for our student body, about a quarter come directly from undergraduate study. The average age is 25 years, but there's a broad range. There are people that are coming directly from undergraduate, people who have had decades of work experience. About 10% have other degrees, MD, PhD, nursing, and so forth. Many have at least 2 years of work experience. Our students come from every state and almost from every country around the world. About 70% of our students work part-time. Now, if you're thinking of going into the MPH full-time in the fall, I would not suggest working that first semester. It's just too much with the 4 courses. But after that, people often pick up a part-time job once they've got their feet wet and they figure out how to manage their time and so on. About half are involved in research projects while they're here, and you'll hear much more about the nature of those projects, and about half belong to a professional organization. This is really for the parents, friends, and guests. Our graduates are highly sought after by recruiters and employers. They are very satisfied with the training that our students get. About 92% of our graduates in 2018 were employed within 6 months of graduation. In this room, every year we have a big career fair where we have employers come here, they meet with students, and they look for talent, and every one of them says they have met people that they would like to hire. That happens year over year. So our graduates are well prepared to enter the workforce and are highly sought after. The 2020 U.S. News and World Report rankings just came out. That's what the 8 balloon is there. And we are ranked 8th in the United States. This just came out 2 weeks ago. That's why the balloon is still here. So we thought we'd use it. 8th in the United States of all schools and programs of public health. We are in the top 5 among private schools of public health and the top 5% among all schools and programs of public health that were ranked. If you're interested in healthcare management, that program has a separate accreditation, and ours is the only MPH program in the top 25 and the highest ranked program in healthcare management in the Northeast. And we can tell you much more about that if you're interested. If you have any questions, I will be around all day. Hope to meet each and every one of you through the course of the day. But if there's a question unanswered or if you think of something on your way home, please do not hesitate. Feel free to write me. The best way to get me is email, and I'm happy to answer any questions that you might have. Again, welcome and congratulations to all of you.
Good morning, everyone, and welcome to Boston University. My name is Mike McLean. I'm the Associate Dean for Research and Faculty at the school. And congratulations again on your acceptance. This is really a great achievement. We know that you've worked hard to get to this point. You know, we've enjoyed learning about you from your applications, and this is an exciting day for us where we get to, if we haven't already, we get to meet you in person, and you get to learn more about us. So, you know, I hope you've taken time to celebrate and feel proud about this accomplishment. So I realize that many of you are not, you're not coming to us because you're interested in being trained as a researcher, becoming a researcher. Maybe you're not really interested in engaging in research while you're here. If you are, there's plenty of opportunity. But even if you're not, your time with us is going to be profoundly shaped by everything that we do in research here at the school. Research is really at the core in the way it affects all of our other activities at the school. It's an engine that affects all of our educational activities and, importantly, all of our public health practice activities as well. So in the classroom, you're going to be learning from the people that are on the cutting edge of research methods who are also engaging in research activities. So you're not only learning about cutting-edge methods in the classroom that are being used in ongoing research studies, but you're going to learn examples from work that's either recently been completed or it's in development. And then outside the classroom, there's plenty of opportunity for you to engage in all phases of conducting a research project. Importantly, the research we do here at the school, we're not just doing to publish journal articles for other scientists, to go to fancy conferences and present in nice places. Those are important things to do for sure. But the main point of our research is to try to solve real-world problems. We are trying to address important public health issues and make sure that our findings can then be translated into real-world action. So that's another element of an important aspect of your time here is going to be to learn about those translational activities. What is the best way to take the findings of new ideas, new findings from research, and making sure that they end up getting translated into action so that they actually have an impact on real-world public health. So just a quick snapshot of our research portfolio. We have about a $50 million research portfolio at the school. Most of it is funded through government agencies, NIH, DOD. The majority of it is through federal agencies. Although we also have a large amount funded by large foundations like the Gates Foundation, Robert Wood Johnson Foundation, and then we have some partnerships with the private sector as well. Within the university, the School of Public Health is just one of 17 schools and colleges at Boston University. So it's a real benefit to us to be part of such an enormous research institution because this place can be as big or as small as you need it to be. What I really love about our environment here at the school is, as students in our community, it can be a very small, supportive place where you're maybe working closely with your advisor or within your concentration or within a particular department, maybe even within our school in that beautiful building across the courtyard. But then when you need it to be, when you need more resources, it can expand out to be one of the largest private universities in the country. With our research portfolio at the university is close to $500 million. It's, I think, $490 million. And the resources that we have available to support everything that you want to do here are really extraordinary. So I love that this place can sort of expand or contract to the extent that you need it to, depending on what it is that you're interested in doing. Now, I'm sure when you heard, you heard Dean Galea say that I'm the guy in charge of the think. And I wouldn't be surprised if when you heard that, you thought, that sounds like a guy who might talk for a really long time. And I could, because you can imagine with $50 million of research, there's a lot that I could share with you, but I am not going to do that to you today. But I will just instead give you some examples, some highlights to give you a sense of the kind of work we do here, to give you a flavor. So I want to start with an example of resources. This is just work that we're affiliated with here at the school. You heard Dean Sullivan mention her work with the Framingham Heart Study. This is really an amazing, a landmark contribution to epidemiology. 3 generations, over 15,000 participants that have been studied, for 70 years. In fact, the term risk factor was actually coined through work at the Framingham Heart Study. So that gives you some sense of what a key role Framingham has played, not only in important findings around heart disease, but now it's been expanded to study pretty much any health outcome you can imagine. Also, the Black Women's Health Study is another example where for over 20 years now, we've been following a cohort of 59,000 black women spread out all across the United States. The cohort was originally formed to study diseases that were especially a problem among black women, like diabetes and breast cancer. But now that study also has been expanded to study many other health outcomes as well. They get studied every 2 years, for over 20 years now, and that continues with a huge archive of biological samples and a wealth of data that continues to get used as a resource to study, emerging outcomes as well. And then finally, an example from my own work. My background is in environmental health. I study environmental and occupational exposures. And the Superfund Research Program has also been in place for over 20 years. And that's a program that's designed around studying the kinds of hazardous chemicals that are found at hazardous waste sites. to look at what the potential health effects are of studying, of being exposed to those chemicals, and also, importantly, trying to figure out how to either reduce or eliminate exposures to those types of chemicals. So these are examples of resources. I wanted to give you some particular examples of projects, and as I've said, you can imagine there's a lot to choose from. So in trying to come up with ways to share it with you, I thought I'd share some headlines with you. Maybe these are studies that you've actually already seen because they were captured in the media, and we don't care a lot about that aspect of it, being caught up in the media. But what's important to us is when it does show up in the headlines, that means we're doing work that it matters to our communities, it matters to populations. If I do a bunch of science and no one cares, that leads me to start wondering whether I'm studying the right things, right? But when we see our work showing up in headlines, it's at least one indication that we're on the right track, that we're doing important, impactful work. So here's an example. This is work that was done by Professor Bohr in the Department of Global Health. And everyone knows that there was a somewhat surprising result in the last election, and there's been speculation about to what extent socioeconomic factors may have played a role in that surprising result. And so what Professor Bohr did is he looked at all of the counties across the United States. And in general, life expectancy has been increasing over time. But what he did was he looked at the trend of life expectancy in all of these different counties. And there were some where life expectancy has been increasing as we would expect and we see on average. But there are other counties where it has either stayed the same or there's actually been declines in life expectancy. And so if you divide the counties up into those two groups, you find that the areas where people's health has been gradually improving over time tended to vote for Clinton. And the counties where it's either stayed the same or declined tended to vote for Trump. And that provides some insight about what the mindset of people living in those places might have had when they went to the voting booth. If you are looking around you and we think generally like, is my life getting better, right? Or is my life getting easier? Is my life getting better? And you look around and you see that while the rest of the country's life expectancy is increasing, and where you live, you're not seeing that. You're actually seeing increasing problems and declining health. You can see how that might affect someone's choice when they go to the voting booth. He may not be the answer, but something's got to change, right? And I think that's what we may have seen some of. As another example, we do a lot of work on addiction and in particular the opioid epidemic. Professor White in the Department of Biostatistics focuses on health surveillance. And she found, it was previously estimated that around 1% of Massachusetts population was suffering from opioid addiction. And what she found is actually closer to 5%. You can see she was looking at data from 2015. There's always a little bit of a lag of getting your hands on data like this and then being able to analyze it. But her findings support what we all know is that the opioid epidemic is serious and worsening and continues to need more attention. Professor Siegel in our Department of Community Health Sciences, he's someone whose name you may have seen quite a bit. Around this issue of gun control as a public health issue. He's really been one of the leading voices on this subject. And he, again, looked at gun ownership by state and also to see how that might be related to suicide rates. And there's a common narrative where people will say, well, if it wasn't a gun, it would have been something else, that it's not because of the guns that we're seeing, the suicides. But what he actually found is that gun ownership was the single largest predictor of the suicide rate, which suggests that the actual availability of firearms is leading to an increase in the number of suicides. It's not just a substitute for maybe some other means. And then finally, sometimes I see some of my own work appear in the media. I'm involved with the group here at BU that studies head impacts and chronic traumatic encephalopathy among NFL players and other populations. For me, I'm involved in that because, like I said, I study exposures. And this is really, most of the time we're studying chemical exposures, but this is an example of physical exposures, having repetitive impacts to the head or even to the body, which can end up having a negative impact on the brain. And you may have seen this in the news. The New York Times picked it up where we looked at the pathology of 111 former NFL players and found that 110 of that group actually had CTE, which is really alarming, of course. And so our group has done a lot of work on this, and you've probably seen the BU group's name in the media, sometimes getting yelled at by the NFL. But most of the time, moving this work forward. This always reminds me of my most memorable occasion of surprisingly seeing my own work show up in the media. We had just published a paper on former NFL players, and we looked at the age at which they started playing football. And we looked at players that had started before the age of 12 compared to after the age of 12. And so when we evaluated these players later in life, we found that the players who started playing before the age of 12 had much worse cognitive function later in life compared to those who started after the age of 12. We looked at it that way because age of 12 is an important age for brain development. And I'll mention another benefit of doing that is that it's a very simple analysis, but it speaks to the question that people want answers to. Right? Parents want to know, is it safe for my kid to play particular contact sports? Right? And this gets at answering that question. So in my mind, this is an example of how we're trying to do work that has a real world impact. Right? This is work that somebody can pick up and read, and it helps them make decisions. Where if we used fancy metrics that were harder to interpret, that wouldn't be as meaningful to non-science populations. But anyway, we published this paper, and one morning I plopped down to watch SportsCenter, and Outside the Lines was on, and I don't know if you've ever seen Outside the Lines. It's basically 60 minutes of sports, right? It's like the 60 minutes equivalent in the sports world. And I had my coffee, I turned it on, and there at the beginning of Outside the Lines is my name scrolling across the screen. And so, the first thing that happens is I threw up in my mouth a little bit. And then, of course, like the second thing was I called into the next room to my wife. I'm like, honey, I'm on ESPN. Which, I don't know if you can tell by looking at me, but I'm a scientist. So that was pretty much my only shot of having my name scroll across the screen on ESPN. But again, I share this with you because for us, it's an important sign that our work is having an impact, on real-world population health. So what does all of this mean for you? What it means is, even if you choose not to directly engage in research, you're going to be learning cutting-edge methods in the classroom. You heard our Dean of Education talks about the research she's involved in. I'm the Dean of Research, but I'm teaching students in the classroom. I'm mentoring our doctoral students. So on the research side, I'm involved in education. On the education side, she's involved in research. It's all very closely tied together. If you do want to engage in research, there's many opportunities, all the way from the early stages of writing a grant application to actually conducting the projects in the field, doing data analysis, presenting at conference, and maybe even producing a manuscript. And then ultimately, the most important thing is to make sure that the work we do has a real-world impact, and you'll learn the skills about translating research into practice. So if you do want to get involved in research, your advisors, of course, are a great first stop for you. They can help connect you to types of opportunities that are a good fit. As Dean Sullivan mentioned, you can go to any faculty member. One thing I guarantee is they are always happy to talk about their research. We do have an open door policy. You can pop right in, or you can send them a short email and say, I'm interested in learning more about your work, and I guarantee they will be delighted to tell you about how interesting their work is. We have great resources for you to link up with opportunities in practicum opportunities, internships, fellowships. We have a SPH Handshake, which is a website designed to try and, it's basically a search engine for you to seek out those types of opportunities. And our career services office is outstanding, and there's people there that can help, basically help you find your way to a good match. Finally, the BU Human Resources website, we are constantly hiring research staff, research assistant positions. All those full-time positions are posted on the Human Resources website. I mention it because the university does have a really wonderful tuition benefit for employees. So sometimes people may choose to become full-time employees on research projects so that they can gain the experience while also pursuing their master's degree on a part-time basis. So I just share that in case that's of interest to you. So I'm very easy to find. If you're interested in learning more about research opportunities or even just have questions about the school, I'm always happy to chat. Feel free to reach out. And welcome again. I hope you have a great day.
Good morning, everyone. My name is G. Marie Bonifilio, and I'm here on behalf of the Development and Alumni Relations Department. So as Dean Galea and Dean Sullivan had mentioned, we have almost 10,000 alumni globally, so it's a really active network that you can connect with fellow SPHers globally. In addition to that, you're part of the Boston University Network. Boston University has over 330,000 alumni globally as well. So you're not only part of the SPH community, you're part of the BU community. So upon arrival here at BU, we really encourage you to integrate within the greater BU community as well. So we have about 10,000 alumni in 117 countries. Now we need to update this so you can kind of see where we are globally. In addition to that, we have representation for all 50 states. Along with what Dean Sullivan said, 92% of our alumni are employed within 6 months. The highest concentration of our alumni are in Washington, D.C., New York, San Francisco, and right here at home in Boston. So with that, we do really encourage networking. With that, we have regional groups. My slides are a little out of order, so I'm going to skip ahead. We have regional groups for Facebook and LinkedIn, so that way if you choose to leave the Boston area after graduation, you can find fellow alumni and continue those networking opportunities. In addition, upon arrival here as a student, we encourage everyone to join the BUSPH Alumni LinkedIn group. That's a way to start your networking from day one. You get on LinkedIn, you join, and you can see where alumni are and where they're working. I'm going to go back one. In addition, our alumni help with career advice, practicum opportunities, internship opportunities, mentorships. It's really a way to connect with our alumni. They love their experience here, and they love connecting with students. I talk to alumni on a daily basis, and connecting with students is probably one of the best ways to stay connected to BUSPH, so they're happy to do it. We encourage our students to do it, and our office loves help facilitating those relationships along with the career and practicum office. So now I'm going to go ahead. In addition to our regional Facebook pages and our LinkedIn group, we have a monthly newsletter called SPH This Month. That is something that we like to share alumni features, upcoming news and programs, the research that our alumni and our current students and faculty are doing, as well as announcements of the school. In addition to that, as alumni and as current students, you participate in a tremendous amount of events here on campus. We have our Dean's Level programming, which happens right in this room. There's about 10 events each semester, and they're really topic specific, and that's a great way to network as well. And then we're also global. Our group travels the country and the globe putting on alumni regional events. So our Think, Teach, Do events, the past one was this week in DC, coming up one in Boston, Raleigh. We're in Geneva, Miami, Minneapolis. So if you're in any of those regions, please join us. They're really great opportunities to not only network with fellow alumni, but we travel with Dean Galea and a faculty member. So as you can see in Miami, Julie Rafeman will present. And it's a way to keep engaged with the research that's happening here on campus and continue your learning after you leave campus. I hope to see you all soon. We will be moving to the Crosstown building, which means nothing to you right now, but if you accept and you're on campus, it's a little bit down the ways. We really enjoy talking to students and connecting with students, so if you are here, come find us in the Alumni Relations Department. We like to interact with our students, and we're here to help you. I hope you enjoy the rest of your day.
Good morning, everybody. I'm Harold Cox. I'm the Associate Dean for Public Health Practice. So the most important question of today, what do we imagine that is? Who's here from Texas? That's the most important question of the day. All right, so let's see those hands again. A lot of y'all. Good, where? My mother. Do you know her? I'll give you her number. Where from? Okay. Who else? You're with her. Okay, got it. Houston, y'all know each other? Get to know each other. I'll give you both my mother's number so you can go and talk to her. And who's here? Well, the rest of y'all too. So I'm glad that you are all here today. Welcome to our school. Now, I have another important question. Who here wants to make a difference in the world? Okay, good. Who wants to have a succeeding and a wonderful career? Good. Who here wants to be rich? I see a few parents raising their hands. So I can't do anything about the last question. But if you want to be in an environment and in a career that's going to make a difference in the world, where you are going to be on the front line of doing something important for others, then that's public health. Public health is that discipline that involves all of us and every aspect of our lives every day. When you get up in the morning and you take that very first breath of fresh air, there's usually been some person there, not literally, but kind of around, who was regulating the air and ensuring that the air quality was going to be good. When you take that first drink of water in the morning, there's someone who has been around to ensure that the water is going to be safe. When you go to McDonald's and have that, and I don't know where the vegans go. I just can't understand that at all. But when the rest of you go to wherever you go in the morning for that first egg McMuffin or whatever it is that you have, there's been somebody around who is going to ensure that the food that you're eating is safe and of a good quality. That's what public health is about. When you go to work during the day, there's going to be someone who is around to ensure that people have been properly immunized so that you will lessen your chance of getting rubella, measles, and mumps. When you go at the end of the day to your massage parlors and to your tattoo places, there's going to be somebody there who is ensuring that you are not going to come in contact with some blood-borne pathogen. And then throughout the day, there are people who are on the front line helping us to think about how do we make certain that we live a healthy life, ensuring that you are getting enough water, getting enough exercise, wearing seat belts, wearing condoms, and other kinds of things. And then in addition to that, there's those individuals who are thinking about issues around gun violence and climate change and a variety of other kinds of things that impact all of our lives. Public health is that discipline that will allow you to be on the front line, to be involved in the lives of people at many different levels. So if you want a career where you're going to be on the front line, it's public health. And then if you want to go to a place where health is the primary thing that we do, it's Boston. This is the premier place for coming and learning about health. I promise you that there's somebody at this school and even at that other place down the way whose name we don't call, the one that begins with H. We never say it aloud in this place. I'm not allowed to say their name at this place. But there's somebody at this school or someplace in this community who's probably interested in something that you are interested in, and will be able to connect you with others who are interested in those kinds of things. And then finally, if you want to come to a place where we are on the front line thinking about teaching about public health, it's Boston University. We are smart, we are engaging, we are fun, usually, and we are wanting to make this the kind of place for learning about public health, being involved in public health, and doing research about public health. The area that I'm responsible for here at the school, one of them, is the Activist Lab. The Activist Lab is a project that we started a few years ago to allow our school faculty, staff, students to be on the front line of thinking about and being engaged in real-world activism. And this particular project has a number of different activities that we're doing. I want to just bring a couple to your attention. One is the innovation grants that we provide to students. We provide a number of grants that that are from about $100 up to about $3,000 for students to be involved in projects that they want to be involved in the local community. We've had students who've done a lot of different kinds of activities. For instance, we've had students who have been putting together go bags for individuals who are homeless and who are moving into their first home setting. And some of the things that you would never remember that you need to get, like pots and pans, are in those kinds of bags. We've had a group of students who were involved in working in a community garden and bought tools for the community garden, as well as provided small stipends for young people to work in those gardens. We, last year, gave out about 15 of these grants, and this year we also have just selected about 15 people to also, and groups, 15 groups to be involved in this. The other thing I wanted to call to your attention, you may have seen the mural that's outside, and if you haven't, make certain that you do. It's the mural that's right in front of Talbot Building, and I want to tell you a little bit about what that is. Last weekend, in this room, we had about 150 high school students who were here Friday, Saturday, and Sunday to think about and learn about advocacy on behalf of gun violence. And they spent a lot, and these were kids who came from the New England area. And they were here to understand what is gun violence and how does it impact our lives and what are the kinds of things that you need to do in order to address the issue of gun violence from the perspective of policy. And then when that program was over, they went outside and they made a mural. The mural was made was facilitated by one of the parents of a kid from Parkland who died. And I want to just show you what that looked like. This kid was the kid who died and whose father came and facilitated the process. And I encourage you to go back and look at it again. I noticed something when I was looking at it this morning. In the corner, there's actually the father sitting looking, and it's a very poignant moment that the camera was able to catch of the father looking at his own son. If you want to be at a school where things are happening, this is the place to be. So look, here I've said a few things to you. I've said, if you want to be involved in a discipline where you are on the front line and you're thinking about helping others and being involved in helping others, public health is that place to be. If you want to come to a place where there is health is the primary thing that happens here, and where we care about students, and where there are some really good parties that happen in Boston, Boston is the place to go. If you want to come to a place where folks are thinking about teaching and doing public health all the time, Boston University is the place to come. Now, is Boston University School of Public Health the place for everybody? No, it's not. But that's why we didn't accept them. We didn't accept everybody. But we accepted you. And now we hope that you will accept us. So today, as Lisa and Mike have said to you earlier, we hope that you will spend this day learning about everything that you need to know, that you want to know. Make certain that all of your questions are answered. And if they're not answered, at the end of the day, there's a reception, and I'll be back, and others will be back as well. Make certain that you stop by and you talk to us so that you can make certain that you get the questions that you need to have answered as you are making this very important decision. And I agree with what our dean said. Whatever decision you make is going to be the right one. I'm so very glad that you are here. Welcome to our school. You can clap for me. Go ahead. I could see the anticipation of, should I clap? I should clap. Go ahead. That's great. I'm going to invite Mike and Lisa to come back up. And we're going to be able to answer a few questions for you right now, and then we'll move to the next part of our program. Is there a mic?
We'll use this one because the mics are going around the room.
Okay, got it.
Any questions? The floor is open. Don't be afraid. Yes.
So you can obviously tout that you have an accredited healthcare management program. How successful would you say students of that program are able to find administrative fellowships after graduation if they're interested in doing that?
Yeah. So the question is, we have this highly accredited healthcare management program. How successful have our students been in finding fellowships after graduation? Administrative fellowships. So our Career Services Office has a web page, and on that web page, it lists the outcomes by certificate. So I would encourage you to look at where our graduates are going. I don't know the exact percentage of that particular placement, but you can look at the web page and see for healthcare management, where do people go, you know, what kinds of positions. And this afternoon, our director of that certificate will be around, so I would encourage you to ask him because he will know that specific answer for you. Sure. Yep. There are mics going around. That way everybody can hear.
Can you talk a little bit about how research opportunities at the school practicum fit in with part-time enrollment while you're planning on working at the same time?
Sure. I'll start, and then maybe you want to add to this. So we do have a number of students who study part-time. I will tell you that usually about 80% of our students begin the program full-time, but then that number switches as people get engaged in research opportunities or when they get further into their program. So it's not 20% part-time all the way through. It goes up because people engage in other things. So we have a lot of students studying part-time. We have a part-time student organization who has advocated for more flexible course offerings to make sure that our course offerings can accommodate people. We also have the practicum office has also identified a number of practicum opportunities that can even be done remotely for people who are working and can't extract themselves. So we do try to work very hard to accommodate people who have other engagements. So absolutely, for sure, this is important for people to be able to work part-time and to be able to make progress in their programs. Do you want to say anything about research? Or?
I think, you know, students who end up, you know, if you start full-time and end up getting a full-time research position so that you switch to part-time student, I mean, it does extend your stay in the program, of course. Students end up taking, you know, usually 2 classes a semester while working full-time. But, I mean, what ends up being a nice opportunity is if the research position is particularly at the school or even on the campus, it's the easiest possible way to be a full-time employee and a part-time student because you're physically in the same location where, you know, and plus you're working in an environment where, I mean, we're an education institution, right? So like when I've had research assistants who were part-time students, I'm probably the most understanding supervisor possible about needing to run off to class. You know, that's not always the case if it's somewhere else. So I think those are really nice opportunities when there is a good fit for a research opportunity. You're gaining professional experience, of course, continuing to make a salary, while also working through the program. And it gives an opportunity to integrate what you're doing in your job, you know, into, you know, what you're learning in the classroom.
You talked about integrating practicum research and work opportunities expected to be distinct, or is there a possibility where you can kind of work all of those into your program?
Yeah, the practicum needs to be something outside of your regular job responsibilities, because the idea is that you're actually applying something new that you're learning in the classroom. Now, that said, it can be done at your place of employment, but it wants to be something different so that you're extending yourself, you're applying some new skills. But that is totally possible. The other piece is that oftentimes the practicum is a source for material opportunities that lead to the integrative learning experience, where you develop a work product. So that may be a particular opportunity that you can take on at your place of employment to pull something together for your ILE. And again, practica lead to career opportunities as well. So sometimes people go into a place for a practicum and it ends up leading to a job. So that also happens. Yeah.
Field that most MPH students end up going into? Like, do you normally see a large part of the class have a similar career outcome, or is it very diverse in that respect?
The largest functional certificate is epidemiology and biostatistics. Probably no two students in that particular certificate do exactly the same thing. So even though that happens to be the largest, there are many opportunities for students who have the same functional certificate. So again, I would encourage you to look at our website on the Career Services and Practicum Office, because for each of the functional certificates, they give you some data as to where, what sectors, what kinds of positions, employers that our students are going into from each of those certificate areas. And what you'll see is within each one, there's a wide range.
Can you do a dual concentration, like if you wanted to do EPI and, as well as public health policy and law?
Sure. So you can, I should have said that, thank you. You can, if you wish, do two functional certificates. It just takes, as you might imagine, a little bit more planning and coordination in terms of the courses that you pick. But yes, if you see two options that are functional certificates, you can certainly pair those. Yep.
You mentioned that there was online coursework offered. Is that just for the MPH, or is it also for the MS?
At the moment, we are just getting into online. So for right now, for fall of 19, the only online we have is for the MPH in the core courses. We are working towards putting courses that are part of the MS degrees online. And so I don't have an exact time schedule for the launch of those things, but I'm happy to talk to you about your interest, because we have a set of priorities that we're working towards. So it may be that there are some options that might suit you while you're here. Yeah. Oh, go ahead. That's fine.
You guys spoke a little bit towards social justice and activism within the school. Is there like a center? Thank you. A center on diversity and inclusion with the school, and if so, could you speak a little bit to that as well?
We have a dean, an assistant dean for diversity and inclusion, who has a number of different programs that she is responsible for. She's been particularly doing, I'll talk about two in particular. We do a project called BU Reads, which is an opportunity for everyone coming into our class to read a particular book and then to be able to reflect on that book. And it's a good way of providing some grounding for individuals. Last year we read the book of the life of Henrietta Lacks, and then also invited the family of Henrietta Lacks to come to the school to be part of this. And then also our Dean of Diversity and Inclusion has been involved in talking about having programs on complex issues and difficult issues, and has put on a number of different programs that have been addressing the issue of how do you talk about some things that are very complicated and difficult. We just had one the other day of what happens when you've got statues that are up, and there are some people that say you should take those statues down. There are others who say you should leave those statues up. So there are a number of program activities, and then within each of our programs, there are aspects of racial issues and diversity and inclusion that get addressed as well.
I suppose this is more of a logistical question. How do course offerings change depending on the semester? So if you change from full-time to part-time, is there ever a chance that a course that's required perhaps is only available in the fall, so it pushes you back an extra semester? Or do electives switch every semester? I suppose I'm just trying to get an idea of if it changes
no,
at
it's a
all.
good question. We offer about 300 courses per year. So we have fall, spring, and there are 2 summer sessions which are more condensed. We are roughly on the same schedule of offering each year. We're working very hard to publish a schedule 2 years out, but you can imagine it's actually quite difficult with so many courses. So if you're thinking about switching to part-time, that's a conversation to have with your advisor about this is what I'm trying to do, what's going to be offered next semester and the semester after that, and how am I going to complete things. Courses that are required for certificates, we try very hard to offer every semester so that no one is delayed. What you'll find also is for each certificate there are required courses, and then there might be choose one of these 4. And so absolutely you will have options, every semester so that you don't lose ground.
Lisa, maybe one more.
One more question. Okay, one more right here. Okay. Whoops.
Hello?
Yes.
Okay. So you talked a little bit about travel grants. Are there any conferences in particular you try to bring a big group of students, like maybe the Geneva Convention?
The Geneva Convention.
No, you know what I mean. I'm sorry. The World Health Organization Convention, my bad. Sorry.
The conference that most of us go to, I'm sorry to disappoint you, is the American Public Health Association meeting. So lots of our students participate in that. Now, there are also professional meetings in each of the disciplines, so environmental health will have their annual meeting, biostatistics has their annual meeting, and students go to all of those. But I will say probably the one that our students mostly go to is the American Public Health Association. Last year it was in San Diego. This next year it's in Philadelphia.
Okay, thank you.
I don't know where it is the year after that, but I don't think it will be Geneva. Okay, so we're going to move on?
Yeah.
Okay.
So you'll have an opportunity to ask many more questions throughout the day, and I encourage you to do that. One of the things that we want you to do now is to have an opportunity to understand a little more of what happens in our classroom and to be on the front line of addressing some of the important issues of the day. And the issue that we want to think about today is about climate change. So we are going to ask you to actually think about how would you address that particular issue. And you are going to be assigned to a number of different groups. Parents and family, friends, others who are with you will come with a few others of us, and we will answer your questions as well. To get us started on this particular discussion is Professor Jean Van Seventer. Professor Van Seventer is a professor in the Environmental Health Department, and she's going to give us an introduction to climate change and get us rolling on this particular issue. Thanks, Jean.
Hi, so I'm Jean Van Seventer, and I'm a professor, faculty member in the Department of Environmental Health and also director of the Infectious Disease Certificate. And what I'm here today to do is to give you some background about a lunchtime case study that you're going to be doing, in which you will work to formulate a public health preparedness plan that would be implemented in the event that a Hurricane Sandy, Marie, Harvey type storm hit Boston. Why are we having you do this? It's not to torment you or to keep you from having a relaxing lunch. Rather, I think you'll really find it an enlightening and fun case. What we want to do is to first give you a feel for what it's like to be in the classroom here, where active learning as opposed to lecturing is a core pedagogical principle. Another reason is that by working through the case, you'll come to appreciate that solving very large and complex public health problems like climate change requires the collaboration and integration of expertise from a wide sphere of professionals, both public health professionals and non-health professionals, as well as partnerships between stakeholders from many sectors, such as law enforcement, government, private industry, and very importantly, from community members. The case will make evident to you that applying skills that you will learn in various functional certificates, such as the EpiBiostat certificate and the environmental health certificate, will be important for solving these problems, and it will also demonstrate the need for input from and knowledge that's derived from context certificates, such as the infectious disease certificate and maternal and child health certificate. I need to forward slides. I was just realizing. There we go. This is the, that thing. Oh, great. Okay. So, good. Lastly, the topic of climate change is thought by many to be the most important public health problem of the 21st century. For this reason, it is the focus of many in the School of Public Health as well as the wider BU community. In our environmental health department, Patrick Kenny, who actually was the creator of this presentation, is working to develop urban scale solutions on climate change that would be good for the health of both the planet and for the health of human populations through reducing emissions from cars, increasing green space, and providing more opportunity for physical activities in cities. Now, to give you a background for this case study, and I'm going to review the connectedness between climate change and health, and then talk about what you'll be doing in the individual classrooms. Climate change, as I said, is thought by many to be the most important problem of the 21st century. In the US, it's still a controversial issue to some. There are a number of reasons for that. One is it's a complicated subject. The climate system is complex and it has many drivers. Another is that for many, there's a lot of reasons to ignore the impact of climate change. Why? Because it's in the future, they think. It's not. You probably realize by events just in the last week. Also, it's affecting other people more than it's affecting us. And some have an invested interest in keeping the subject confusing and keeping controversy alive. But accumulated evidence from climate change science, while complicated, can be distilled into 5 simple facts, as it was done, and I'll show you, by the Yale program on climate change communication. First, scientists are in agreement. It's real. It's about us, both that we are a cause and we are being affected, and it's bad. But lastly, there's hope. And this is what we focus on working on in the school. In terms of climate change being real, what you see here is a graph that depicts the change in the Earth's average temperature over the last 150 years. And while controlling for things like urbanization and microclimates, what you can see is that the average temperature of the Earth has increased by about a degree centigrade, or 2 degrees Fahrenheit. Now, that might not seem like a lot to you, but you have to think about the average temperature of the Earth as an indicator of the health of a very complex system. The Earth has components, its oceans, its atmospheres, its winds. And think about it, if your temperature increased by 2 degrees Fahrenheit, you know something is wrong. You know that there's a loss of homeostasis or health, some disease is going on. And in the same way, we look at this increase in temperature that's going on in the Earth as an indicator of negative effects of climate change. So you see here that the temperature has increased by about 1 degree centigrade, and also that it's on a very sharp trajectory that we need to address. Of much concern is in 2016, we had the hottest year on record. 2017 and 2018 were the third and fourth hottest. If we consider what impacts we have had, climate scientists have developed climate system models to project future increases in temperature, as you can see here. They make assumptions on what society will do in terms of greenhouse gas emissions. And what you see is the shady areas depict the difference in uncertainty between models. Well, the models don't agree perfectly, what the data is very convincing in showing is distinguishing between a scenario of if we are smart as a global community in blue and are able to control emissions and limit additional warming by about 0.5 degrees to 1 degree centigrade, Celsius, or business as usual scenario, where temperatures are projected to increase at least in another 2 or 3 degrees. And this is just in this current century. This really could be much worse. So you see the temperature increasing, and what about it being bad? It's bad when we look at what is going on in terms of the effects of climate change on the environment. You know that there's an increase in temperature, average temperature going up, polar ice caps are melting, but some of the most severe effects are associated with water. And it's centered around whether water goes where water goes or doesn't go. Paradoxically, some places will get wetter and some places will get drier. It's an interesting paradox, and the reason for it centers around precipitation and climate change, in that when the atmosphere is water, when the atmosphere is warmer, it will hold more water, so that when it rains, more water comes out, but in between, we can have much longer periods of drought. That's what will happen to the environment, but what about to people and their health? We can look at the effects of climate change and health in 2 ways, direct effects and indirect effects. If we think about the impacts on the environment and then on health, one of the most direct ways is for a big storm to hit a coastal city, resulting in flooding and destruction. We've heard about that in these recent hurricanes. We've also heard about the direct effects of heat waves that kill individuals. Besides the direct effects of droughts and storms occurring, one of the important things to realize is that the intensity and frequency of these is increased. Indirect effects also will occur. Some of these indirect effects, if we consider them on vector-borne diseases caused by mosquitoes that are the cause of malaria and Zika, it will have an effect on the ecology of these vectors so that it can increase their geographical range. We'll see these diseases occurring where they didn't occur before. And also, it can increase the competency of these vectors to transmit the disease, meaning even where the diseases are occurring, there's going to be an increased incident. The direct and indirect effects, these are mediated or they're intensified or tempered by vulnerability factors. Some of these factors are public health infrastructure, something that you will be able to affect when you leave here. And I just show you and have mentioned some of the things that can happen, have effects on infectious diseases, respiratory diseases, and things that you might not think of, like mental health. Allergies. Allergies is something you might not think of as affected by climate change. But climate change with higher levels of CO2, which acts like a fertilizer for plants that produce pollens, means that increased temperatures are going to increase the intensity of the pollen season, and it's going to start earlier and go on longer. So as a society, we have a number of things that we can do to affect the impact of climate change. These are divided broadly into mitigation and adaptation strategies. Mitigation being strategies to reduce greenhouse emissions, or actually to take some of those greenhouse gases out of the atmosphere, and adaptation strategies, which recognize that climate change is already occurring and that regardless of what mitigation efforts are made, we're going to have to deal with these for several decades until things stabilize. The case study today is focused on adaptation strategies that can take place to minimize the effects of a storm that hits Boston. Meanwhile, climate is changing and we need to be ready for this. And so today what you're going to do is put yourself in a scenario now, spring 2019, and in Boston, and we are planning for the potential impacts of the 2019 hurricane season. Your assignment is to develop strategies to minimize those impacts, assuming a worst case scenario in which there occurred during Hurricane Sandy, in which the storm surge coincided with high tide and there was severe coastal flooding. You're going to also, an important part of this is to recognize the disparate impacts that climate change related effects have on vulnerable communities and populations. This is a look at Superstorm Sandy to get you ready and thinking about what you're going to do. And there were a lot of things that you might not readily consider that were a problem after that storm. Hospitals had to be evacuated and nursing facilities as well. There were respiratory concerns. There were injuries that were related to trauma. There were mental health problems. So what this is showing you is a map of Boston, and you can see maybe snaking along the Charles River, and to the very right you can see Logan Airport. And what we have depicted in blue is the flood zone for a 1 out of 100 flood that's projected for 2070. So considering sea level rise and the storm surge, you can see what is going to be flooded. And well, the pink demonstrates areas of vulnerable populations as reflected by low-income neighborhoods. And what you can see is, well, there's not a complete overlap of coastal floodings with those pink areas. You do see also that in the area of the Back Bay, and where actually we're sitting historically, which was bay and was filled in to make the south end, it's a very diverse neighborhood. There are very high income areas and there are very low income housing areas with many vulnerable communities. And you're going to have to think about how you're going to address the problems that these communities will see as a result of the storm. There are things in place already. We have a very strong public health and healthcare infrastructure in Boston. The Public Health Commission employs about 1,100 individuals, and they provide essential services for homeless shelters, environmental health services, infectious disease bureau. Our Boston EMS ambulance service employs 350 EMTs and paramedics and has 16 stations throughout the city. We have 20 licensed hospitals, 6 are level 1 trauma centers providing highest levels of care. And there are many, many long-term care facilities to consider, home health agencies, specialty care, and mental health agencies. We have to know how to help them. So you're going to be thinking about immediate effects like drowning, down power lines that can cause electrocution, but also about people getting isolated without power. They're not going to be able to move around. They can't go to the pharmacy to get medications or to go to ambulatory clinics. You'll need to think about loss of access to clean water and food, and what contamination there might be due to toxic chemicals or infectious agents. Over the long term, you have to think about the displacement and where people who are living in shelters might live, and the mental health effects, which can be very prominent after a storm like this. This is just to show you, Boston has something called the Medical Intelligence Center, the MIC, which is mobilized during emergencies. This depicts mobilization that took place during the Boston Marathon bombings. It's a fairly well-developed infrastructure, and it integrates well with Boston City law enforcement agencies. So the case study, we have it here. There are going to be 3 focus areas for you to consider. One, preventing toxic and biologic exposures. Another, preparing for population displacement to evacuation shelters. And preparing to address acute and chronic healthcare needs, people who need to get into the clinic, those who are at home and have healthcare people come to them to take care of them. In each of these, you're going to think of the significant issues that need to be addressed, identify the vulnerable target populations that will be served by addressing the issues, develop the strategy that's needed, and also identify the parties that are responsible for carrying out each part of this preparedness plan. So it is a lot of fun. It really is. We've done this a number of times, and it's also a way for you to get to know some of us. You'll be having faculty that will be facilitating each of these sessions, and I hope you enjoy it. Thank you. We're going to now have a little bit more explanation.
Perfect. Hi, everyone. Is everyone ready to get up? Not quite yet. I'm Angela Colette Acevedo. I'm Assistant Director of Admissions here at the School of Public Health. I'm going to help lead in dividing you all up for lunch. I would just ask that the families and the guests please stay seated. You are going to get escorted at the end once all of the students have left. So we're going to start with Group Blue. So if you have a blue sticker on your folder, you're going to be the first to get up. Choose your lunch in this beautiful glass room over here, and we're going to have an ambassador and a faculty member lead you down to your classroom. And feel free to leave your stuff in here. So if our blue ambassadors and also Sophie Godley, if you could just point yourselves out so the students know to follow you. So we have some vegan options, vegetarian options. All right, we're ready for Group Green. If you have a green sticker on your folder, you'll be going with Dr. Wendy Heiger-Bernays. She's holding up her sign right now. I'm actually just realizing you guys will not be back up here, so if you could take your stuff. You can leave your jackets, but definitely take on the coat racks. If you want to leave your jackets on the coat racks, but take the other bags and things with you. You can leave your coats either on the coat rack. There's a coat rack there, or there's a coat rack outside of this. Yeah, outside this room. We are doing tours, so if you want your jacket for the tour, you will have the opportunity to come back up here. Somebody will be always up here. To go. Okay, now it's time for yellow group. You're going to go with Dr. Jennifer Schlesinger. Okay, if orange group would like to get up next, make your way over to the back. Dr. Carol Dolan will be the facilitator. South End, yeah. All right, now we're ready for our last group, Group Black. Yes, oh my gosh. I was gonna say, I recognized you. How are you? Oh, that's right. Oh my God, how are you?
It's funny. I don't want to.
Are you an MS student?
MS.
Oh, fantastic.
for
Oh my God,
fall-
we'll have to
fall time.
connect.
Yeah.
You
figure
staying
it.
the whole day?
I'm probably gonna leave like after lunch.
Okay, after lunch. All right. Yeah, nice to see you. All right, last but not least, our parents and guests, if you'd like to get up, you're going to go downstairs to 201 with Dr. Cox, Dean Sullivan, and Director of Grad Student Life, Mary Murphy Phillips. Grab a lunch,